You're listening to the CDKL5 in Color podcast. It's June, and that means it's CDKL5 Awareness Month. We are doing things a little differently on the podcast this month. We're diving into some emotional topics and sharing insights direct from our peer caregivers. Our children who live with CDKL5 deficiency disorder are so loved, but life with CDKL5 is hard. So join us as we talk about it. Let's jump right in.
Hi, Amanda.
Hi, Marissa.
How's it going?
I am excited to be carrying on into our next subject for Awareness Month.
Yeah, we're pushing through with these awareness topics for CDKL5 that we asked our peer caregiver community for their input. So this week 3 is what does your family need more of and or less of in the CDKL5 life? So we looked through all the responses that people gave. There were themes, right? So the themes about what do they need more of? Not surprisingly, a big theme was needing more support and more respite, which is the number one thing that people come back to us when we have guests on the show and we ask them what are their unmet needs. Respite is usually the number one, more support for the family. So that was one of the themes. And then another theme was better interactions with doctors, with the medical system. So we'll get into that a little bit, but that was kind of interesting. And then themes for less, what do they want less of? One of the themes was pity, right? So less comments on, oh, I'm so sorry for you in your life. Not helpful, usually. And then less hurdles, less bureaucracy, less burden. So we'll get into what people said in a little bit. But what about you? What do you think your family needs more of or less of in life with CDKL5?
Well, I don't deviate from the needing more respite care or more support in my house. I also think it would be nice to have, and I think we're getting there, but a society that's a little bit more accepting of people with differences and having your children out in the community at times when maybe they're not on their best behavior. I want to be less of a spectacle when we're out, if that makes sense. And I think part of that just comes from people getting used to the idea that we're not all the same. So,
Yeah. Well, that's why
and
inclusion matters, right? I mean,
yeah,
I was
exactly.
having a
That's why,
conversation with one of my girlfriends here when I dropped Gregory off at school. She was dropping her son, who's also in the special ed classroom. And so then we were chit chatting in the parking lot. And she was telling me that she had made arrangements with the teacher in the school to have her son be in the chorus. And she had asked another one of our friends whose son's in 5th grade, was he going to be at the concert? And the mom didn't realize her son could have been included in that. So he wasn't in chorus or band because she didn't advocate for him, and nobody from the school advocated for him to join either. And we had this conversation about why it was important for my friend, even though her son doesn't really sing the songs. He knows the songs, he doesn't really sing the songs. But it was important for her that if he had any sort of enjoyment to do it at all, that he be included. And this is what I think some people don't realize about inclusion in schools is it translates to inclusion in society. Seeing people with disabilities sharing spaces with you. Our kids exist all the time and they should be seen. And when you see them at school, then you're more accepting to see people out in public.
and you realize there's a lot more people like that than you imagine,
Yes.
too. And I mean, people need to remember that disability is one community you could always become part of. You never know. You may find yourself here one day too. So one last thing I want to say about what I need less of is administrating Ava's services. Like, I spend a lot of time with a lot of different agencies reporting on things that overlap, that honestly aren't important in the scheme of things. They are important to this agency because they want their I's dotted and their T's crossed. But we have very complex systems. We have Medicaid waiver systems with large wait lists. And once you get into those systems, I think people don't realize it's not over. Every year you're doing qualifying paperwork, nursing, you're recertifying every 60 days. It's intense. I would like to think that, our government would believe people like our kids are disabled and not going to get better the first time. But for some reason, we're punitive about this stuff and we make families like ours justify the support we get for the rest of our lives for our children. It takes a lot of time.
Yeah. Well, I mean, that's how our society is, right? You have to prove that you're entitled, and you have to keep proving you're entitled. And it is an incredible burden to
And
make people jump through so many hoops, because where's that all that documentation that you're doing going? It's sitting in a computer somewhere. It just sits there doing nothing. I mean, we were on the wait list for our Medicaid waiver for 5 years. And when my son qualified, I have to have a nurse come out to my house every 6 months and go through the same assessment every 6 months for him still to be eligible, when in 6 months, he's not going to go from someone who needs total care on a feeding tube in a wheelchair to not.
yeah.
On no planet is he not going to
Well, and
qualify in 6 months. I mean, could you at least just do it once a year? Could you at least
once
just
every
do it
5
once a
years.
3 years? Yes. It just makes me so mad. Why do I have to do this every 6 months with you? Every 6 months.
Well, and
It's
as a
so ridiculous.
the amount of the burden we carry to make sure that we're worthy. And here's the thing, oftentimes it's not enough. I'm still picking up odd jobs to cover things for her that the system doesn't cover. Equipment. There's so many things that we really need that would keep us safer and our children safer that are hard to get. So if you're listening and you're not living this life, it's not like people are waiting to hand us wheelchairs or lifts or home modifications or the things that you really need every day to make sure everyone's safe. It costs a lot of money to rehab a back injury. Anyway, so that's my list.
Yes.
Could we all just decide, we know what this diagnosis is, we know there's no magic pill. Could we decide that these children maybe could go through this every 5 years?
Right. Just ease some of the burden.
It doesn't get better as an adult either, I'll tell you that. I
Mm.
actually have to report to the court now every year in ways that feel very intrusive to me. But anyway.
Mm. Well, when I think about this question for myself, obviously I agree with everyone that more respite is needed, more nursing for me is needed. But also, you and I had talked a little bit before we started recording about more social workers knowing the system. Because my experience, and I think yours, and I think most people's, is if you're a disability parent, you're getting advice on how to navigate the system from other disability parents. And that's not the way it should be. You should be getting that advice from people who are professionals who should be supporting you through the process. Your pediatrician should know about your state waivers and be telling you about them. Social work, my son's been in the PICU a few times, and I've gotten to know the PICU social worker. And I mentioned the Katie Beckett waiver, and she didn't know what I was talking about. Explain to me how you're a social worker in a children's hospital system and you don't know about this Medicaid waiver program for medically complex kids. It makes no sense. And I mean, I'm a social worker and I have my MSW. And I'll tell you, when you go to social work school, you learn the broad scope. And when you get your job, you learn about your job. So I understand she didn't learn about Katie Beckett waiver in social work school, but she works in a children's hospital. She should know what it is.
Yeah.
It's frustrating.
I mean, you don't know what you don't know, but it's unacceptable. I've had that experience with my school when we were transitioning her. They slapped down this folder and it had information on adult waivers that they thought I should apply for them. And I'm like, you should slap this down in front of 14-year-olds, because if they're not already in the system, it's going to take them the next 4 years, possibly more. They're going to be on a wait list now for this adult service. And that kind of took me back a little bit. I'm like, you're not helping people transition when you don't understand the system and how it will serve them, indefinitely. So
exactly.
More social workers for many reasons would be great.
And so I think more for that, but then less of these wait lists. Come on. I mean, no kid with medical complexities and profound disabilities, no family should be on a wait list for help with that kid. I'm in Connecticut. That's one of the richest states in the country. And the wait list was 5 years. It's outrageous.
I agree. It's ridiculous, but our whole healthcare system could use a makeover.
And the sad thing is you don't realize how bad it is until you need the help.
Yep.
So we asked our peer caregiver community what they wanted or needed more of or less of. And so let's read a little bit of what they said.
So on the more side, more help for parents, more people willing to care for our children, more mental health support, and respite care. and more nursing. There's a lot of different ways we need help.
Yeah.
That's the first one.
Then people said we need more doctors who understand what we're going through. It's been a struggle to find doctors who discuss with you and not talk at you. This 100% for us in the beginning was the biggest hurdle. Finding doctors that listen to you because you know your child's best interests instead of throwing their doctor weight around and not discussing options. That's interesting. I don't know that I've ever had, well, I mean, I guess everybody's had that experience where the doctor is sort of high up on being a doctor. But that's not generally my experience. But it is special to find the doctors that you can have a true collaborative relationship with.
It is a big bucket, and we should actually probably do a podcast on this sometime. I walked into dermatology a couple years ago, and the dermatologist, he probably was he's fairly new, early 30s, and he says to me, what does she understand? And I said, I think she understands most of what you said. And he said, okay. And so he stopped talking to me, and he looked at her, and she had some warts we were dealing with, and he was like, I'm going to give you a shot in your hand on your wart, and we're going to see if they'll go away. And Ava was like, all right, and he gave her the shot, and we were done. And he was like, she's the best patient in a while, because Ava's fine with needles, and she watches, and she's that's one thing she tolerates well. So why I bring this up is I think that medical doctors are getting trained better and are more aware that they are going to run into kids like ours, whether it's in primary or a specialty care like dermatology, right? I think that people are trying to get better. I did some work with child neurology about 5 years ago on transitioning patients like ours into adult care. I'm not sure we're getting better there because they don't like to deal with the comorbidities that our kids have with neurology. But I do have hope that they're training doctors better. And I do think those sticklers who maybe don't want to listen or don't, you have to find some way to work together. But sometimes I think if they don't know what to do, they just become obtuse. Instead of saying, I don't know, like that's where you capture my heart. If I ask you something and you don't know and just say like, well, I don't know, but it could be X, Y, or Z, or we could try do, then I'm like, all right, well, this is a human. Like they're humble. They're willing to tell me, I don't know. You have my permission to tell me you don't know. Like, I don't expect you to be the answer man.
Right.
I need help, but if you can't answer the question, that's okay too.
Right. Well, a lot of times the questions we have don't have clear answers.
No,
that's the reality of
it's an
CDKL5.
evidence.
Yeah.
Yes. And I think that's another thing. They work off of evidence-based body of literature and knowledge and anecdotal stuff. It's not that they don't believe you, but they cannot act on that. That
Right.
is, they have a medical license, they have ethics they follow, and it doesn't make you wrong and it doesn't make them wrong, but you have to be respectful of that reality.
I think when you see a younger doctor, like you mentioned, that dermatologist really trying to be person-centered with Ava and include her in her care, that is also like thinking about our conversation about inclusion earlier. The more these doctors know they're going to see people like this, the more society knows these people are out and about. They're not in institutions like they were 40 years ago, 30 years ago even. They're out and about. They're part of the community. They're deserving to be part of the community. You have to figure out how to provide care for them and how to interact with them. And I do think hopefully it's younger doctors that are learning and being taught those skills. And then hopefully they're being mentored by doctors who have been around a while and have realized it's also the best way to be with families and patients.
Mm-hmm. Yeah.
I mean,
I will say in my 20 years, big shift. Like that was the one thing, one of the younger doctors on this child neurology project, what she says to me, Amanda, I guarantee you that in this generation is trained well. And once we get to the next generation, she's like most of these old guards that have a terrible bedside manner with children like yours will be out. She's like, we got a hold of that because a lot of what we think about when we're doing advocacy for training medical doctors is like, how do we? They have to learn a lot of stuff. How do we say, oh, and then by the way, you're going to have nonverbal kids with parents that, come from a variety of socioeconomic backgrounds, and it's on you. It's a little overwhelming. Everything takes time.
Yeah. And it's obviously still a need because we had people mention it. Mention it.
Yes, and for the people in like healthcare deserts and really rural areas, like I can't imagine. I hope that at least your doctors have access to doctors to consult with to help meet your needs.
All right. Last for more understanding and consideration from others. For example, my daughter's specialty pharmacy medications, they could be auto-renewed and shipped instead of me having to call every month and wait on hold to do a refill. Or when we go for a visit for a research study, someone could come and meet us in the lobby and offer to carry something or offer a place for us to leave our things during the day. It's all the little things that pile up over the course of a day, a month, of a lifetime that really take a toll. So that was that area of wanting more
extra hands.
yeah, support.
Yeah. Yeah.
Support and
And
understanding.
our home care is in this huge medical, level 4 trauma center, and I'm used to navigating it. I know where everything is. I can't imagine even parking at Children's. I mean, in Denver, we see from Montana to New Mexico, and they even pick up some Utah people. So you've already driven or flown to get here, and now you're in this huge area. You're like, where is what? You get in, and there's this huge atrium, and it's like, which way do I go? So concierge services, especially people who are unfamiliar with the territory, would be
Makes a huge difference.
yeah, it'd be super for hospitals to think about that. Or maybe request it. I would assume they would have volunteers or someone to come and meet your needs.
Yeah. I mean, I think that's something that's really important to share is that don't be afraid to ever ask for what you need. I mean,
And it's hard to ask for help for some people, but do it.
but do it. And I mean,
Yeah.
especially in a hospital system, they're paying people like Child Life to
Well, they have
support your family.
volunteers at a minimum, if not, social workers or child life specialists to come and help you.
Yeah, ask.
And if you don't know
Alright.
what child life is, I think we should mention that, because if you're not in a big system, you might not even know. If you're going to visit one of these big hospitals and you think, gosh, I could use some sensory toys for my kid, or I don't know that they're going to set for an echo for their heart or something, tell them that you need child life, or tell them you need somebody to come and help you entertain. I think that's the easiest way to say it. And they're going to know. And child life is amazing. And when you're impatient, ask for child life. It's amazing.
Mm-hmm. Yeah, they're there to help your child understand what's happening. If they can't understand what's happening, to at least offer comfort and other tools and strategies to make the experience the best it possibly can be for your child, for all the children in the hospital. And sometimes that's education for children who can access that, education to what these are the procedures that are going to happen, and here's what you might experience. But then also, like you said, sensory toys, other things.
They'll bring a big bubble tube in for Ava because that'll distract her. Like they have a sensory cart with projectors and
Cool.
vibrating things, weighted blankets. I'm sure somebody could find something like that for you if you're in a bind.
In terms of what people said about what they wanted less of, this is what people said. Do you want to read the first one?
Sure. Less questions about more children. Definitely less comments about needing to experience the joy of a typical child. Less pity from people. The constant, oh, I'm so sorry with the head tilt, or the, I don't know how you do it. And I agree. I think I've said it on this show before, but if not, I have a thing for Ava that she accepts compliments, not pity. And there's some days that's all that flies out of my mouth. Like, do not come and tell me how sorry you are that our poor, pitiful life exists.
Yeah.
It's snarky, and I don't always love to hit people with that, but sometimes they deserve it. So, anyway.
Yeah. I think there's a difference between empathizing with someone and saying, I'm so sorry because I know that's hard and I care about you, versus, oh, I'm so sorry, woe is you. It's different.
Yeah.
And I don't think anybody appreciates being pitied.
No. It's that whole, I don't know, Brene Brown, she has that whole little empathy cartoon that many of you have probably seen, which it's like, sometimes you just need to sit with me and help or listen, and don't assume you need to fix the things that look undesirable in my life.
I don't think I've ever seen that.
I'll send it to you. Oh, we can link it. We can link it in the
show notes.
Yeah.
Neat. Then the last quote we have is less bureaucracy. The programs where we live are really hard to get into, and we have a high deductible plan with my husband's job and end up paying so much every year. Yeah. I mean,
we touched on it.
We talked about it earlier. Yeah. It's hard to get. There's wait lists. It's hard to get in, and it's expensive. I mean, having a kid with CDKL5, it's not cheap.
No.
It's not cheap.
And there's so many things that aren't medically necessity that you really do need to facilitate your life in a way that's, less burdensome. So there's some things that you'll pay for, I'll pay for a $200 suction toothbrush when Medicaid doesn't think she needs one, because there's no way I'm getting things done without it. So yeah, I mean, it's GoFundMe. A lot of
Mhm.
people trying to get
Foundations too, like, there are local foundations in every state that will
adapted
buy yeah,
bikes.
adapt your home, buy equipment that insurance doesn't cover. There's oh, you know what? I'll link in the show notes is there's this mom, she has this Advocacy Abby on Instagram, but she also runs a website where you can look for foundations in your state to be able to get things like an adapted bike because you know insurance isn't gonna pay for that, or home modifications, like you said, AAC, communication equipment,
Yes.
things like that. So I'll link that in the show note too. But yeah.
In my area, there's a couple different equipment exchanges essentially, but they sell, they sell for very discounted price things that are um, donated to them, and you can buy it for cheap. So
Mm,
look for secondhand medical.
yeah.
I mean, each state is a little bit different, but that's something to look around at. And find your local support groups, online or wherever, because they know what's happening
Yeah.
in your backyard, and they can help you navigate things that aren't specific to CDKL5, but more living with a disabled dependent.
Yep. Awesome. All right. Well, I'm glad we got to chat about this episode. I hope everybody's enjoying our June awareness. I love hearing from our peers. I think this has been awesome.
Yeah,
It's
it's
been
fun.
super fun. Yeah.
We should do it more often.
Yeah. All right. Well, have a good
Okay.
afternoon.
You do the same. Bye,
Bye.
Marissa.
Thanks for listening. We hope you'll follow us on social media at CDKL5 in color on Instagram, Facebook, and LinkedIn, and visit us online at www.cdkl5incolor.com. Have questions or a topic you'd like us to chat about? Would you like to be a guest on our podcast? Email us cdkl5incolor@gmail.com, and we'll be in touch. Until next time.